it really is an emotional thing for men, and practitioners like Eve really make a huge difference. You're in a state where you don't know what's up and what's down, and people like Eve who kind of help hold your hand and walk you through this process are invaluable, and take advantage of it.
Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. For Men's Health Awareness Month, we're highlighting the importance of education and support for men experiencing prostate conditions. According to the American Cancer Society, roughly 1 in 8 men will be diagnosed with a prostate condition during their lifetime. Focus Ultrasound is an innovative, non-invasive treatment option with FDA approval to treat prostate conditions and international approvals across 50 countries. There are a number of manufacturers with Focus Ultrasound devices to treat prostate conditions, including Profound Medical, the company behind the MRI-guided TULSA-PRO system. This technology uses Focus Ultrasound energy to precisely heat and destroy targeted tissue in the prostate without the need for surgery. We're joined by Eve Satterthwaite, a patient educator with Profound Medical who guides men through their treatment conditions and what they can expect from the TULSA procedure. And our second guest, Bob Palmer, is a prostate cancer survivor who received the incision-free TULSA procedure. Together, they'll share both the patient and expert perspectives and address common questions men may have when deciding on the right course of treatment for them. Eve and Bob, welcome to the podcast.
Thanks for having me. This is a great opportunity.
Thanks for having us.
Tell us about the beginning of your experience with prostate cancer.
Well, I knew I had put off going to the doctor for quite a while during the pandemic, and I finally just scheduled time with my primary care physician, and he said, "Let's just do a full workup." And lo and behold, my PSA was a little high, and I'd always been very mindful of my PSA because my father, unfortunately, had passed away from prostate cancer. So when that came a little high, and he said, "You need to go to the urologist," it was alarming.
Do you know how long it had been since your last screening?
It had probably been about 2 years since my last screening, and the levels weren't at a point where they were saying, "Hey, this is alarming" or anything, but it had moved up quite a bit for sure.
Right. That's wild that it changed that much in only 2 years. And it's not uncommon for men to push off those screenings for 3 to 5 years, but all it took was 2 years.
Right, Allison. And I can't stress enough for people to just stay on top of that. Every time you go to your general practitioner, insist that you get your PSA screened. And I think that's just kind of routine for men, actually, but insist upon it. For sure.
So you got the news and the diagnosis. What were the options your doctor presented to you after that?
What I was able to discern and understand is that, I had an option of a radical prostatectomy or a robotic prostatectomy or some radiation treatment. And then there were various other things that I could look into. But, walking out of that appointment, I felt a bit shell-shocked and kind of just didn't know where to turn other than, to the internet and just start doing my own research.
And Eve, what are the most common concerns or questions you get from men like Bob who are trying to decide on the next course of treatment, if they want to go the surgical route or if they're looking into Focus Ultrasound and seeing if that kind of treatment is right for them?
Yeah, I think across the board, Allison, the most common concern is men want to maintain their quality of life. They don't want to wear diapers for the rest of their life, as I'm sure Bob can tell you. That was one of his biggest concerns. They don't want to lose their sexual function. Some men may be older when they get diagnosed with prostate cancer, but that doesn't mean that we should just write off their sexual function. So I am a patient educator, but I'm also a registered nurse. And I want to make sure that they really understand the clinical aspect of these different treatments, prostatectomy, radiation, and then the ablative techniques, of which TULSA is one of those. I would say the most common question that I get, funny enough, has to deal with insurance. These medical treatments are expensive, and the patients want to know if their insurance will cover the procedure. So we're always going to check with the center that they're interested in, and direct them to see if the center accepts their specific plan. A really great development recently is, as of January 1st, Medicare is now paying for the TULSA procedure if you have the procedure in a hospital setting. So I usually reiterate that, but the patients really need to go to the center themselves to check their insurance.
And can you briefly go through the main options of treatment for men who have prostate cancer? Can you go through what those might be?
Of course. So the standard of care treatments, there's primarily two of those. And it's going to be surgery, which is the prostatectomy. There are different ways of doing that. The kind of way of the future is the robotic prostatectomy. So it's done laparoscopically. The physician sits at a treatment desk and controls the robot to do the surgery. Secondly is going to be radiation. And again, there are several different types of radiation and methods of administering that radiation treatment, all the way from external beam to more focused radiation or implanting radioactive seeds.
And so, Bob, what made you go with the TULSA-PRO treatment?
Well, all those options seemed kind of archaic to me. Because my dad had gotten the brachytherapy, which is the radioactive seeds, some 30, 40 years ago. So once I started to do some research and realized that these were some of the potential side effects, I began to get concerned, even though I had scheduled my prostatectomy almost immediately after being diagnosed. As I started to tell people, hey, I've got prostate cancer, get your prostate checked. People said, don't worry about it. It's prostate cancer. They've got things for that. You'll be fine. Well, upon doing some more research, you find out, hey, well, there's the possibility of incontinence. There's ED. So as I began to do research, I ran across a friend and he said, hey, you really need to look into this TULSA procedure. It's incision-free. There seem to be little or no side effects, and it's virtually almost outpatient surgery. I was also afraid just to be in the hospital overnight, and that's a real concern.
What was it about the TULSA-PRO that made you decide on that course of treatment? Was there anything that just sealed the deal?
It just seemed like it's where we should be at this day and age with surgeries of that nature. It's ablative technique versus, incisions, and the research showed that there was little to no side effect. And the most amazing thing is if it didn't completely work, you could go back and do it again, unlike the other therapies. So those were the things that were attractive to me. What really kind of sealed the deal was actually talking to Eve eventually.
And Eve, what do you typically talk about with patients like Bob? How do you guide them through understanding the TULSA procedure and how it compares to other treatment options?
Yeah, being a registered nurse, I want to make sure that they understand exactly what to expect from the TULSA procedure. So we'll start with where are they on their prostate cancer journey? I want to be an advocate and really walk through that journey with them. So then we'll go through, what is the TULSA procedure? What does it look like? What are they going to experience? Then we'll move into what are the risks and benefits. Bob mentioned a lot of the benefits, that there's no blood loss, there's no hospital stay. We actually just had our CAPTAIN trial preliminary study data come out. And Bob mentioned the data as well. So I really want them to understand the clinical data that we have. That's what their physicians are going to ask about. And so we want to make sure that they're very well prepared and researched on this procedure. And so our CAPTAIN data is level 1 evidence that shows that there's no blood loss, no hospital stay, and patients actually have quite a bit less pain from the TULSA procedure than some of the standard of care treatments. Then we'll move into insurance coverage. Again, as I previously said, encourage them to reach out to a center to find if they accept their insurance. And then I'll ask if they have any questions. And men, once you get them going and they open up, they usually have a lot of questions, as I'm sure Bob can attest to. So I want to make sure that all of their questions are answered. When you really tell patients what to expect, it relieves anxiety. And that's what I want to do as a nurse.
And so, Bob, you decided on this treatment. What were you feeling right before you were scheduled to have it?
Well, if I can take us back just a little bit. So, you find something like TULSA, and the way that TULSA does it is you go to the website and you kind of register as you being interested. And the first person that you talk to is someone like Eve. And I talked to Eve. And it's so great to hear your voice, Eve, and it kind of takes me back to how relieved I did feel after talking to somebody who was sympathetic to exactly what I was going through. That point in time is very tough. As soon as I discovered TULSA, I canceled my robotic prostatectomy. I was able to schedule working with Eve at a facility nearer to me, and to be able to go ahead and put that on the schedule and understand what that was going to be all about. I think the thing that was also very comforting before the surgery was getting a kind of a diagnostic MRI, where then the doctor sat down with me and said, "Hey, look, this is your prostate. Here's where your disease is in your prostate. And here's where we're going to come in and do X, Y, and Z."
Eve, for men who are getting the TULSA procedure, what can they expect during the treatment? And are there any common side effects that may come up afterwards?
Yeah, so I want to definitely make sure that the patients know exactly what to expect from the procedure. And there's 2 pivotal items that I cover with every patient. The first one is that the TULSA procedure is conducted under general anesthesia. So the patients aren't going to feel any of the equipment being inserted. They're not going to experience claustrophobia if they are claustrophobic in an MRI bore. And then after the procedure, they're going to have a catheter. So they'll have that for approximately 7 to 14 days. And that time range depends on the treatment plan. So in other words, how much tissue they're going to have ablated determines how much time with the catheter. I usually take a little bit of time kind of demystifying the catheter because it's not a pleasant experience, as I'm sure Bob can tell you. He says often after the biopsy, the catheter was the worst part. So really going over what is a catheter, why is it necessary? And the reason it's necessary is to keep the urethra open, because what's left of the prostate and the surrounding area within the patient's body is going to experience an inflammatory response. So there's going to be a lot of swelling inside. And we want to make sure that the patient does not experience any urinary retention. So then oftentimes I'll go over catheter care because UTI can be a risk if you have a catheter. We'll talk about, that the center and the physician is going to educate them on how to take care of that catheter. The most important thing is to keep it clean. And they may administer some prophylactic medications to prevent a UTI. But all of that's going to be determined by the physician's order. The majority of TULSA patients are really back to their daily activities within a few days, except for the catheter, and they experience very little downtime. So we kind of go over all of that. I'll answer any questions that they have on specific items about that.
And Bob, what was your recovery like?
It was great. Like Eve said, and we've spoken since, the catheter was probably just more of an annoyance than anything else, in terms of you're not used to that. And there was a little discomfort there near the end. My biggest worry was making sure that, you kept it clean and kept it, sanitized so that I wouldn't get any infection. And that was great. Just coming out of surgery was very easy. I had a friend with me. We went out to dinner that night afterwards, and then really kind of back in action, back at the gym, working the next day, but then back in the gym in like 7 days, and then on vacation with my kids within 14 days and enjoying time on the beach. So exactly what I had hoped it to be in terms of the recovery, and then discovering all that my functions were fine, and over a short period of time.
And Bob, how has this experience changed your outlook on health and wellness, especially during Men's Health Awareness Month?
Well, like I said, I can't tell enough people, and I'm just so happy to be here on Curing with Sound, just to echo that. Get your prostate checked, know your options. Most men probably have a partner or a wife or a daughter or a son that's going to walk through them through this process. And I just want to make sure everybody knows that TULSA is a fantastic option when treating prostate disease. I also understand, a lot of men have BPH. And trouble urinating, and this is also a great option for that. So if you're having trouble in that area, and from a men's health perspective, know that TULSA-PRO is an option for you.
And Eve, what's the most rewarding part of working with patients like Bob?
Thanks for asking that, Allison. It kind of sounds cliche, but I truly enjoy helping people. I receive comments from patients all the time like, you're the first person that really listened to me, or you've given me hope again. And that's the most gratifying feeling there is when you've, taken this huge, worrisome subject like cancer and really given patients some peace of mind. I absolutely love my job. Part of being a nurse is advocating for patients. And that's what I get to do for men every day and their caregivers, is truly be an advocate and walk through their journeys with them. I loved doing it for Bob and for all my other patients.
What would you say to others who are considering focused ultrasound treatment for prostate cancer?
Do your research, understand what your options are, and knowing that there are probably more modern treatments than you realize out there for you to consider.
Yeah, exactly what Bob said. You need to do your own research. You need to become a student of prostate cancer. Physicians usually are only going to tell you about the procedures that they're trained to do, because that's what they're trained to do. So you need to look at all your options, meet with the physicians and the practitioners that do each of those treatments. And then look at the clinical data when you're comparing treatments. A doctor may describe statistics in their patient population, but what does the peer-reviewed published literature actually say? And then look at the options you would have if you possibly had a recurrence. We truly hope that doesn't happen. We pray that when you have a prostate cancer treatment that it's curative, but that doesn't always happen. So some treatments that you could have initially will limit options if you have a recurrence later on. So that's something that I address with all of my patients. You want to look at the risks and the benefits, like we talked about with TULSA. You want to do that for every treatment. And all of that can be really helpful in understanding where you are as a patient and where you need to go for treatment.
If a patient does have the TULSA procedure and they develop prostate cancer again, can they have the treatment again?
They can. TULSA leaves all your options open should you, God forbid, have a recurrence. You can have surgery afterward. You can have radiation afterward. If there's enough tissue left after the initial ablation, you can have a TULSA procedure again. And, prostate cancer, I tell my patients this, is really sometimes better thought of as a chronic illness than something that's curative. If you're young when you're diagnosed, like Bob was, you want to consider those options should you have a recurrence.
Eve, how can listeners get in touch with you or your colleagues at Profound, and how can they learn more about the TULSA procedure?
Yeah, the best way to learn about the TULSA procedure is to go to our patient website, and that's www.tulsaprocedure.com. It's a very robust website with a lot of education on it, and you can fill out a contact us form on the website, and those comes directly to me and my colleague. Like I said, we're patient educators. We're also registered nurses. So you're going to be able to talk to us for as long as you need to. You can call us back more than one time, multiple times as you walk through this journey of prostate cancer. But yeah, the website is going to be the best place to learn more and to get through to me and my colleague.
Well, thank you so much for being here, both of you. Eve, thank you for sharing your expertise and walking prospective patients through the TULSA procedure. And Bob, thank you so much for sharing your story and being an advocate for other men.
Thank you for pulling us together. Hearing Eve on this broadcast really makes me quite emotional because it really is an emotional thing for men. And practitioners like Eve really make a huge difference. You're in a state where you don't know what's up and what's down. And people like Eve, who kind of help hold your hand and walk you through this process, are invaluable, and take advantage of it.
Yeah, it's really special, the relationships that we get to form with these men who are at a critical period in their lives. And it is emotional. I'm near tears right now just hearing Bob recount his experience. And don't make me cry, Bob.
Don't worry. We're on a podcast.
To learn more about the TULSA procedure or to connect with a patient educator like Eve, visit TULSAprocedure.com. This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you'd like to learn more about Focus Ultrasound or the Foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focus Ultrasound. You can also rate and review the show.